Welcome back, students. Now we'll be discussing the anatomy of the neck. Before we discuss the boundaries of the neck, we have to know some of the important structures in the midline. So we'll first discuss what are the structures which are in the front, in the midline of the neck. Then we'll talk about the other boundaries. Okay. So the first important boundary is the midline structures of the neck. So we should know the midline structures here, starting from the symphysis menti up to the manibrum sternum. This is the sternum, and the upper part of the manibrum. This is the manibrum sterni, the upper part of the sternum. So the first structure from the symphysis menti is a modified raphe connective tissue which extends from the symphysis menti. This is the base of the mandible, and here is the symphysis menti. From there, this structure extends. This modified uh, tissue, the fibrous tissue, which extends from the symphysis menti up to the hyoid bone. So this is called as the median raphe or fibrous raphe. The next structure, which is the hyoid bone itself, to which this raphe is attached. So this is the hyoid bone here, very small bone which is present in the neck, which is freely mobile. Below that is the a membrane which spreads between the thyroid cartilage and the hyoid bone. So this membrane here, this is called as the, because it is attached, which is present between the thyroid cartilage and the hyoid bone, so hence it is called as the thyrohyoid membrane. So this is the membrane here, thyrohyoid membrane between the thyroid cartilage and the hyoid bone, so it is called a thyrohyoid membrane. Then below that is the thyroid cartilage itself. We can see the angle of the cartilage. These are the two laminae on either side, and at the center they come and meet, and this is much more prominent in case of male compared to the female. There is much more angulation. This is called as the angle of the thyroid cartilage. This is the angle of the thyroid cartilage, and is formed by the fusion of two thyroid laminae. Below that there is one more ligament or the membrane which extends between a cartilage here. This is called a small cartilage, cricoid cartilage, and the thyroid cartilage. So there is a membrane, this is called the cricothyroid membrane, and this membrane is thickened at particular points, so that part will be called as the cricothyroid ligament. And outside we have also a muscle, small muscle, this is called as the cricothyroid muscle. So here is the cricothyroid membrane, which is modified, thickened to form the cricothyroid ligament, and here on either side we have the cricothyroid muscle, because it is between the cricoid cartilage and thyroid, so that's why it is called a cricothyroid membrane ligament as well as the muscles. Okay, below that is the cricoid cartilage itself, and below that we can see a gland here. This is called the thyroid gland, a very important gland which is present here, endocrine gland, which is present in the neck. And below that we can see this is the part of the trachea. These are the tracheal rings, and this is the cervical part of the trachea, and when it goes below, when it descends below, then it will be called the thoracic part of the trachea. So this is the trachea, which is extending from the larynx. So this is the windpipe here, which is present, which can be seen. So here is the manibrum sterni. So all the structures which are in the midline of the neck, these are called midline structures of the neck, starting from the raphe, the fibrous raphe, then we have the hyoid bone, then we have the thyrohyoid membrane, then we have the thyroid cartilage, angulation of the thyroid cartilage, then we have the cricothyroid membrane and the ligament and the cricothyroid muscle here on either side, and here we can see the cricoid cartilage, and below this is the thyroid gland, and below this is the trachea, which is with the seen, can be identified by the tracheal rings. So these are some of the midline structures of the neck. Now we have to also study a muscle, a very important muscle, which is called as the sternocleidomastoid muscle. Okay, this is the muscle, very important muscle, which is present in the neck. So this is said to be the key muscle of the neck because it helps in all the movements of the neck. And this muscle is important because this muscle will divide the whole of the neck into two parts. The part which is anterior to this muscle, this is the sternocleidomastoid muscle, and the part which is in front of this will be called as the anterior triangle. The part which is behind this will be called as the posterior triangle. So this muscle will divide the neck on either side into an anterior part, anterior triangle, and the posterior part, which is called as the posterior triangle. So if we see the muscle, it has two heads. One is beginning from the sternum, mandibular sterni, this is called as the sternal head, and the other muscle, other part of this, the second head of this muscle, will be beginning from the clavicle. So it is called as, that's why the name sternocleido, and it get inserted to the mastoid process, so hence it is called as sternocleidomastoid muscle. One important thing about the muscles of the neck is they are named according to their origin and insertion. So if you know the name of the muscle, you already know the origin of the muscle as well as the insertion of the muscle. So all the muscles, most of the, you can say most of the muscles in the neck are named according to their origin and insertion. So if you know the muscle, the name of the muscle itself, then you know already the origin and insertion. Here it is called as sternocleidomastoid because it begins from the sternum, the origin is from the sternum, then the cleidome is clavicle and get inserted to the mastoid. So it, in the name itself, indicate the origin and insertion. So here you can see the origin. It begins, the origin of one head, sternal head, arises from the mandibular sterni. It is tendinous, and the clavicular head arises from the sternal end of the clavicle. It is fleshy. So it has a tendinous part as well as the fleshy part of the muscle. And the insertion is to the mastoid process, as well as there is a line here extending. This is called as the superior nuchal line. So it get inserted, the sternal head get inserted to the superior nuchal line, and the clavicular head gets inserted to the mastoid process. So this is the origin and insertion of the sternocleidomastoid muscle. Coming to the nerve supply, so this is supplied by an cranial nerve, the 11th cranial nerve, also called as the spinal accessory nerve. This is the accessory nerve. It has a cervical part as well as the spinal part. So this muscle is supplied by the spinal part of accessory nerve. So here in the picture you can see this is the sternocleidomastoid muscle. This nerve which supplies the sternocleidomastoid also supplies a muscle in the back. This big muscle in the back, this is called as the trapezius. So you should remember that the same spinal accessory nerve will be supplying the sternocleidomastoid as well as trapezius. Also some proprioceptive innervation is from the ventral rami of C2 and C3. Proprioceptive innervation means the innervation with which the nerve can sense the position of the muscle. Okay, so whether it is it is contracted or relaxed or something like that, so that sensation is taken up by the proprioceptive innervation. Coming to the actions, if one of the sternocleidomastoid muscle act, there are two on either side, one on each side, so they are paired. So if one muscle only contracts, it flexes and rotate the face toward the opposite side. When only one muscle contract, it will flex as well as rotate the face toward the opposite side. So this is the origin and this is the insertion. So when it contract, it will pull like this downwards, so the face is turned towards the opposite side. When both the muscles act, at that time there is flexion of both. When both the muscles on either side act, there will be only flexion, and it will be in the center, in the midline. And this is important while getting from the bed. When you get from the bed, the first thing you lift is the head. So this lifting of head is done by the contraction of both the muscles. So it flexes cervical part of the vertebral column and it helps from getting from the bed. So the flexion of the neck is done by contraction of both the muscles. So when one muscle contract, it will flex on one side and it rotates the face towards the opposite. When both the muscle contract, the face will be in the midline, but it will flex in the midline. So this is how the action of the sternocleidomastoid can be explained. Coming to the, it also helps in deep respiration. During normal respiration, it doesn't actually have much role, but during deep inspiration, when the thoracic cage has to be expanded to a large extent, even this muscle will contract and helps in the expansion of the chest itself. So it helps in the, especially in the deep respiration. Okay, coming to the applied aspect, when the nerve is compressed, this especially the spinal accessory nerve, the nerve which is supplying the sternocleidomastoid, it leads to a condition called as wreck neck. Okay, and if there is total damage to this nerve, spinal accessory nerve, as you know, this nerve is supplying two important muscles of the neck. One is the sternocleidomastoid and the trapezius. So, especially during delivery of the newborn, at that time, if a house surgeon or an unexperienced doctor is using the forceps, and if he is during delivery, if he pulls, and this might lead to damage of the spinal accessory nerve, and this leads to a condition called as torticollis. So this is the picture where you can see that the spinal accessory nerve is damaged, which leads to a condition called as torticollis, where the neck is turned towards the opposite side, and the neck is totally on one side, it is flexed to the one side. So this is how it happens. So the damage is on the other side here, where the muscle is not contracting and they are totally relaxed, and these muscles on the opposite side, they are contracting. So this leads to a condition where there is flex neck and there is contraction of the muscle, and it is turning the face towards the opposite side. This is called as torticollis. Now coming to the triangles of the neck. So if you see the neck, it is actually quadrilateral in shape on each side. So this is the whole area of the neck, which almost it looks like a quadrilateral area, and its boundaries we should know before we go to the boundaries of each triangle. So to begin with, as we have seen in the front, we have the midline structures of the neck. This is the anterior boundary of this quadrilateral space of the neck. So this is the anterior boundary, which is formed by the midline structures of the neck, and we have seen what are the midline structures of the neck. Behind, we have an important muscle of the back, a large muscle. This is called as the trapezius. This form the anterior border of this trapezius will be forming the posterior boundary of this area. Then above, if you see here, we have the base of the mandible. So this is the base of the mandible, and it is not complete. So it is completed by an imaginary line extending from the angle of the mandible to the mastoid process. So this will complete the superior boundary. So this is the boundary. So here above we have the base of the mandible, and it at the angle of the mandible, it continues with an imaginary line drawn from the angle of mandible up to the mastoid process. So this boundary forms the superior boundary, and it also continues behind with the superior line. You can continue, and below we have the clavicle. So these are the boundary. Anteriorly we have the midline structures of the neck, posteriorly we have the trapezius, and superiorly we have the base of the mandible, and then an imaginary line drawn from the angle of the mandible up to the mastoid process, and below we have the clavicle. So this is the whole area of the neck. So this area is divided, as I said, by the sternocleidomastoid muscle into an anterior part and a posterior part. The anterior area, this again looks like a triangle, so this is called as the anterior triangle, and there is the posteriorly we have the posterior triangle. So this sternocleidomastoid muscle will divide this whole of this area into anterior triangle and the posterior triangle. So we'll begin with the posterior triangle, then we'll come to the anterior triangle. So now if you see the posterior triangles, so we should know the boundaries of this posterior triangle first. Okay, So this is the area which is present behind the sternocleidomastoid muscle, and the boundaries are anteriorly we have this muscle. This is called as the sternocleidomastoid muscle. The posterior border of this sternocleidomastoid muscle will form the anterior boundary. Posteriorly we have the trapezius here, so the anterior border of this trapezius will form the posterior boundary, and inferiorly we have the clavicle. So these are some of the boundaries, and the apex of this is the form the base. This is the base of this triangle, and the apex is toward the upper part near the superior nuchal line. So this is the whole triangle. So anteriorly we have the sternocleidomastoid, posteriorly we have the trapezius, and inferiorly we have the clavicle, which form the base. Okay, and the part where the sternocleidomastoid muscle and trapezius meet, this point will be called as the apex of this triangle. So these are the boundaries of the triangle. So whenever you study the triangle, you should know the boundaries, then you should know the contents. Okay. Now, before we go to the content, this posterior triangle is again divided into two parts by a muscle which is passing down. This is called as the omohyoid muscle. This is the omohyoid muscle which will divide this triangle, this posterior triangle, into a superior part and an inferior part. The superior up part will be called as the occipital triangle. The part which is below this will be called as the supraclavicular triangle, because it is above the clavicle, so it is called as supra. Supra means above the clavicle, so it is called as supraclavicular triangle, or it is also called as subclavian triangle. Why it is called so, I will discuss later. Okay, first we will see the larger triangle in this posterior triangle. This is the occipital triangle. This is the occipital triangle. So now we should know the boundaries of this occipital triangle. They are similar to that of the posterior triangle, except few changes. If you can see here, anteriorly we have the sternocleidomastoid muscle. So this is the sternocleidomastoid muscle which is present anteriorly. The posterior border of the sternocleidomastoid will form the anterior boundary. Posteriorly we have the trapezius. This is the trapezius muscle which is there. So the anterior border of this trapezius will form the posterior boundary behind, and below we have the, as I said, this muscle is called as omohyoid. It has two bellies, a superior belly here, this is called as superior belly, this is the inferior belly. So this inferior belly of the omohyoid will form the base for this triangle. Okay, so this is called as, the name of this triangle is occipital triangle. The boundaries are anteriorly we have the sternocleidomastoid, posteriorly we have the trapezius, and inferiorly we have this muscle. This is called as the inferior belly of the omohyoid. So what are the contents of this occipital triangle? Very important content of this triangle is the spinal accessory nerve, the 11th cranial nerve. I said this is the nerve which supplies the sternocleidomastoid muscle as well as the trapezius. And if it is damaged, I showed you the picture of the newborn where it has a condition called as torticollis. Okay, so this is the spinal accessory nerve. Along with that, there are also some third and fourth cervical nerves will be coming from here, conveying muscular branches from the cervical plexus. So there will be third and the fourth cervical nerve that also comes from in this triangle. There is also a nerve which is called as the dorsal scapular nerve, which will also come from here. And there are four cutaneous nerves which have been shown here. One is the lesser occipital nerve. Then we have the greater auricular nerve here. So this is the lesser occipital, this is the greater auricular. Then we have the transverse cervical nerve here, and we have the supraclavicular nerves. All these are the supraclavicular nerves. So these are some of the cutaneous nerves which are coming from this triangle. Then there is also the supraclavicular part of the brachial plexus. A part of the brachial plexus also passes through it before it goes into the upper limb and supply the muscles of the upper limb. Then we have in this area we also have an artery. This is called as the superior cervical artery, and we also have the occipital artery. Occipital artery will be here, somewhere here. You can see this picture where the contents have been shown. Here is the occipital artery which is there along with the greater occipital nerve. Here we can see the superficial cervical artery, also called as the transverse cervical artery. and here you can see part of the brachial plexus. So all these are the contents of the occipital triangle. One of the most important content will be the spinal accessory nerve and the occipital artery and other structures which are shown here. Okay, so these are the content. So whenever we ask you the triangles, you should first of all mention the boundaries, then the second important structure you have to mention is the contents. Now coming to the second triangle in this posterior triangle, we have seen what we have seen is the bigger, larger triangle in the posterior triangle, that is called as the occipital. Now we are talking about the small triangle. This is called as the supraclavicular triangle, also called as the subclavian triangle. Even though this triangle looks very small, but it is very important. First of all, we'll see the boundaries, then we go to the contents to know why it is important. First, the boundaries. Anteriorly, if you see here, this is the sternocleidomastoid muscle in the front, and posteriorly we have the inferior belly of the omohyoid, and in below, which is formed by the clavicle, forms the base of this triangle. So anteriorly, in the front, we have the sternocleidomastoid, and behind or above, we can say this is the inferior belly of omohyoid, and the base, which is below, will be formed by the clavicle, the middle one-third of the clavicle. Okay, so these are the boundaries of this triangle. Coming to the roof, just like all other triangles, this is also covered by the skin, superficial fascia, the platysma muscle, and the investing layer of deep cervical fascia, which you already seen. All the structures are superficial, which form the roof. The floor is formed by outer border of the first rib, which is deep inside this triangle, the scalenus medius, as well as the first digitation of the serratus anterior. Coming to the contents of this supraclavicular triangle, one of the very important structure is the third part of the cervical subclavian artery. I said this supraclavicular triangle is also called a subclavian triangle because it has subclavian artery as well as the subclavian vein. These are the main structures. The cervical artery is the main artery of the upper limb, and the subclavian vein. Subclavian artery is the main artery, and the subclavian vein is the main vein which will be draining the whole of the upper limb. So that's why these two structures are one of the most important contents, hence it is called as the subclavian triangle also because of this content. So the name itself indicate that it will have the subclavian artery as well as the subclavian vein. Along with that, there is also the terminal part of the external jugular vein, the superficial vein, which will be draining the head and neck part. So here you can see in this picture the external jugular vein, which will be draining the head and neck. Then there is very important content here, the trunks of the brachial plexus. If you see here, these are the main content of the main nerves which will be supplying the upper limb. Together they are called as the brachial plexus because they come here and they form a plexus, and then they divide, they become the nerves of the upper limb, which will be supplying different parts. Okay, so this plexus of nerves here, they are called as the brachial plexus, and these nerves will give rise to many important nerves, and this can be seen in this triangle. Okay, so this is also a very important major content here. Along with the subclavian artery and the vein, we can see the dorsal scapular nerve, long thoracic nerve to the subclavius, suprascapular nerve, the superficial cervical nerves, suprascapular and dorsal scapular arteries, posterior inferior group of deep cervical lymph nodes. All these contents will be there within this supraclavicular triangle, which is also called as the subclavian triangle. So these are some of the important contents. One is the subclavian artery, the subclavian vein, and part of the brachial plexus. which will be supplying the upper limb. Okay, so these are some of the very important structures which are either going to the upper limb or coming from the upper limb, and these structures are very important content of the upper limb. That's why this triangle is very important, even though it is very small. Now coming to the anterior triangles of the neck. So till now what we discussed is the posterior triangles, which are divided into two parts: the superior, bigger, larger, which is called as occipital, and the smaller, which is called as the supraclavicular or subclavian. Now what we are discussing is the triangle which is in front of the sternocleidomastoid. This is the anterior triangle. Okay. Before we go into the divisions of the anterior triangle, first we will see the boundaries of this triangle. So what are the boundaries? So in the front, so this, if you see here, this is a reverse triangle. So the apex is down and the base is up. So this form the base and this is the apex. So this is a reverse triangle with the apex downwards. Usually the apex should be on the top, but here it is near the manubrium sterni. So what are the boundaries? In the front we have the midline structures of the neck. So these are the midline structures which form the anterior boundary of this triangle. Behind we have the sternocleidomastoid muscle. The anterior border of the sternocleidomastoid will form the posterior boundary of this triangle. And the base is formed by the base of the mandible itself. So this is the base of the mandible, as well as the imaginary line drawn from the angle of the mandible up to the mastoid process. That will form the base. So the boundaries, once again I repeat: anteriorly we have the midline structures of the neck, posteriorly we have the sternocleidomastoid, and the base is which is superiorly placed will be formed by the base of the mandible, as well as the line drawn, imaginary drawn from the angle of the mandible up to the mastoid process. This forms the triangle. Now this anterior triangle is again divided into multiple triangles. There are 4 triangles. To be more specific, it is 3.5 triangles which are there within this anterior triangle. Which are those triangles? We'll discuss one by one. The first triangle is called as the muscular triangle. There is a triangle here, this is called as the muscular triangle. The second triangle here, which is called as the carotid triangle. Very important triangle, one of the most important triangles in the neck is the carotid triangle. The third triangle here, there is one more triangle, this is called as the digastric triangle, or it is also called as the submandibular triangle. And in the front there is a triangle which is called as the submental triangle. Submental triangle, half on one side, the other half will be on the other side. Together on either side of the neck, it will join together to form the complete triangle. That's why it is called a half of the triangle. So it becomes 3.5 triangles. So we'll discuss these triangles one by one. To begin with, we'll begin with the muscular triangle, which is in the front, just beside the midline structures of the neck. So the boundaries, as we know, the anterior boundary is formed by the midline structures of the neck, the lower part of the midline structures of the neck. Behind and above we have this muscle. What is this? This is the superior belly of the omohyoid. So this we studied here. This is also omohyoid. This is the inferior belly. This is called as superior. Superior means above, inferior means below. So this is the inferior belly of the same muscle, and this is the superior belly of the same muscle, that is omohyoid. So behind and above, this will be the boundary, superior belly of omohyoid. Then behind and below on the other side we have this muscle. This is called as the sternocleidomastoid, the anterior border of the sternocleidomastoid muscle. So these are the boundaries of the muscular triangle. In the front we have the midline structures of the neck. Behind and above we have the superior belly of omohyoid. Behind and below we have the inferior belly of the omohyoid muscle. So these are some of the important contents of this muscular triangle. So what are the these are the boundaries of the triangle, and the contents are, as the name indicates, muscular. So the main contents here will be the muscles, the infrahyoid muscles. So that's why it is called as muscular triangle. Okay, so all the infrahyoid muscles, like the sternohyoid, sternothyroid, all those muscles which you can see in here, so these will form the contents of this triangle. There are no important significant structures here, except if we go deep inside, then we can trace the thyroid gland, as well as the trachea, the esophagus. All the structures can be traced when we go deep inside. Superficially, this is the cross section of the neck. So superficially, if you see after the skin, superficial fascia and other things, you can see the infrared muscle. If we go deep inside, only then we can trace all these structures, the thyroid gland, trachea, esophagus and other structures. Usually it is said to be it doesn't have significant structures unless we go deep inside. So that's why it is called as the muscular triangle. The second triangle, which is, as I said, one of the most important triangle, is called as the carotid triangle. This is the carotid triangle. So the boundaries, before we go to the contents, we'll go study the boundaries. What are the boundaries? Front and below, we have already studied this muscle. This is muscle is called as the superior belly of the omohyoid. Okay. Then we have above, superiorly, front and above. So this is the called as one more muscle, which is called as the digastric. This is called as the posterior belly of digastric. There is also the anterior belly of the digastric. So anterior means in the front, posterior means behind. So the same muscle, just like this muscle, superior, it has the superior belly and inferior belly. This digastric muscle has two bellies. That's why it is called as di means two, digastric. So it has two bellies. So this is the anterior belly and this is the posterior belly. So the boundaries of this triangle, the superiorly, is formed by the posterior belly of the digastric, and behind, this is by the muscle which is called as the sternocleidomastoid muscle. So the anterior border of the sternocleidomastoid will form the posterior border for this triangle. So once again I will repeat. Anterior inferiorly, we have this muscle called as the superior belly of the omohyoid, and superiorly we have the posterior belly of the digastric, and behind we have the sternocleidomastoid muscle. So these are the boundaries of this triangle. Whenever it is triangle, it has three boundaries. Always remember, whenever we say triangle, then we should mention that the three boundaries. Okay. Coming to the content, this is, as I said, one of the most important triangle, because we can trace deep inside. If you go, you can see here, these are the structures. This is the carotid artery. So the carotid artery and its two terminal branches, external carotid as well as internal carotid. So these are one of the most important arteries of the neck, because the internal carotid artery doesn't give any branches in the neck, but it will go deep inside and it supplies one of the two major arteries which supply the brain. So this is one of the very important content. The external carotid artery will give a lot of branches, almost 8 branches, and supply the neck, face and scalp, everything. So that's why these are one of the most important content. So that's why it is called as the carotid triangle, because it has the carotid artery, the common carotid artery and its branches. Then along with that, there is, if you can see here, so this is the carotid artery. So it is within the carotid sheath, and we have studied the carotid sheath and its content. So it is one of the content is the carotid artery. The second important content is the jugular vein. This is the internal jugular vein here. Okay, so this is the carotid artery, this is the internal jugular vein, and the third important content of this carotid sheath is the vagus nerve. So very important contents, three important major contents are present here. That's why this triangle is said to be one of the most important. One is the carotid artery, the common carotid and its branches, external and internal. Then we have the internal jugular vein and the vagus nerve. Along with that, there is also, we can trace the spinal accessory nerve and loop of the hypoglossal nerve and the cervical sympathetic trunk. So these are some of the important contents of this triangle. The most important will be the common carotid artery and its branches, internal jugular vein and the vagus nerve. Now coming to the third triangle, which is called as the digastric triangle, or it is also called as the submandibular triangle. It is called a submandibular triangle because it is below the mandible. Sub means below. and it is below the mandibles. That's what is called a submandibular triangle. It is also called a submandibular triangle because it has a very important content that is called as the submandibular gland. So that's why it is also called as the submandibular triangle. It is also called as the digastric triangle because of the three out of the three boundaries of this triangle, two of the boundaries are by the digastric muscle. So here you can see the digastric muscle, the anterior belly as well as the posterior belly form two out of three boundaries, two are digastric muscle itself. So that's why it is also called as the digastric triangle. So we'll study the boundaries of this triangle one by one. The first is the base of the triangle. This is also a reverse triangle with the base above and the apex down. So the base is formed by the base of the mandible. So this is the base of the mandible and the line, imaginary line drawn from the angle of the mandible up to the mastoid process. This forms the base, and below and anteriorly we have the anterior belly of the digastric, and below and posteriorly we have the posterior belly of the digastric. So this is the anterior belly of the digastric, which is anterior and below, and this is posterior and behind. This is the posterior belly of the digastric. So there are these are the three boundaries. The base is formed by the base of the mandible and the line drawn from the imaginary line drawn from the angle of the mandible up to the mastoid process, and anterior inferiorly we have the anterior belly of digastric, posterior inferiorly we have the posterior belly of digastric. These are the three boundaries. What are the contents? As I said, one of the important content is the submandibular gland itself. Along with that, a part of the parotid gland which is present here also comes here. Then we have important group of lymph nodes here which are called as the submandibular group of lymph nodes. Along with that, there is also the facial artery. One of the branches from the external carotid artery is the facial artery, which passes through this, and a very tortuous artery which comes through this triangle and supply the with multiple branches to different parts of the face. So this is the facial artery, and even the facial vein which will be on the side of this artery will be draining the face. So that is also important content here. Along with the with this, there is also some of the structures like the myeloid vessels, nerve, and part of the hypoglossal nerve and the carotid sheath. All this can be also traced here. Coming to the last triangle in this anterior triangle, that is the submental triangle. This is a small triangle which is present in the front, and this is half of the triangle on one side, the other half will be on the other side of the neck. So this will form the half and half together on either side, will join together to form a single triangle. So submental triangle, if you see here, the base of this triangle is formed by the hyoid bone itself, and on either side we have the anterior belly of the digastric here on one side, and the other side will be the other anterior belly of digastric. Together they will form the boundaries. Below we have the base is formed by the hyoid bone, and on either side the anterior belly of digastric of each side will form the apex. So the apex is at the symphysis menti. Coming to the contents, there is not a very important triangle because there are very few contents here. The most important content here will be the submental group of lymph nodes. There are 3 to 4 submental group of lymph nodes which will be draining the tip of the tongue as well as small part of the anterior part of the lower lip. So these are called as the submental group of lymph nodes which are present. Along with, there are also some the anterior jugular vein will be also there. So this is about the triangles of the neck. The posterior triangle and the anterior triangle, which is divided by the sternocleidomastoid. Posterior triangle will have the larger triangle called as the occipital, and below we have the supra-clavicular triangle. Anteriorly we have 3.5 triangles: the muscular triangle, the carotid triangle, submandibular triangle, and here there is a small triangle that is called as the submental triangles. Now coming to the muscles of the back. We'll discuss the muscles of the back because there is also a triangle there. This area is called as the suboccipital region, and there are the following muscles will be present in this back superficially. One is the trapezius. This is the muscle which we are discussing since long time. This is the large muscle, the fan-shaped muscle, which is called as trapezius. Deep inside, if we go, we can see the splenius capitis. Then we have the semispinalis capitis here. You can see here. So this is the semispinalis capitis. Then we also have deep inside, if you go, we'll see with the next picture, rectus capitis posterior major, rectus capitis posterior minor, obliquus capitis superior and inferior. All this can be seen from deep. So here if we see deep inside, then we can see this triangle. This is called as the suboccipital triangle. There is a small triangle deep inside, behind and below the occiput. So this is called as the suboccipital triangle. This triangle is present in the posterior part of the neck. So this suboccipital triangle, a pair of triangles situated on either side of the midline in the back of neck. So on either side there is one triangle, so a pair of triangles. The boundaries being superomedially, we have a muscle here. This is called as the rectus capitis posterior major. So this is the small muscle which can be seen here. This is the rectus capitis posterior major, which form the superomedial boundary. Superolaterally, there is a muscle. This is called as the obliquus capitis superior. And inferiorly, we have the obliquus capitis inferior. These three muscles together form the triangle. So superiorly, we have the rectus capitis posterior major, and superolaterally we have the obliquus capitis superior, and inferiorly we have the obliquus capitis inferior. These three together will form this small triangle. This is called as the suboccipital triangle. The major content is the third part of the vertebral artery. I said the brain is supplied by two major arteries. One I said is the internal carotid artery. The second artery is the vertebral artery. This is called as vertebral artery because it passes through the vertebrae. In the transverse process, there is a foramen in the cervical vertebrae, and this artery will be passing through this vertebrae. 6 out of 7 vertebrae. So that's why it is called as the vertebral artery. And this is also a major artery which supplies the brain. So this is one of the most important content, is the third part of the vertebra. It has 4 parts: first, second, third and fourth part. So this is the third part which will be passing through this triangle. Along with that, there is also the first cervical nerve, which is also called as the suboccipital nerve, which is also coming through this triangle. Along with that, there is suboccipital plexus of veins, which can be traced. So these are some of the important content. The major content will be the third part of the vertebral artery, because this is one of the 2 arteries which will be supplying the brain. So this is about the suboccipital triangle boundaries.